This is a really important question. How does workplace culture influence obesity and stigma? And this is something that a lot of people struggle with. Many people that I work in environments that are, I'm just going to call it obesogenic. They are environments where people don't move very much, where there's often treats or sometimes provided lunch, or some of these break rooms where there's endless snacks, and usually they're not very healthy choices. Sometimes, too, work environments are trying to promote health a little bit on the aggressively side, regulating what can and can't come in, and that often breeds a lot of resentment. This is especially true in healthcare, oddly, where if you go to hospitals and clinics, you will find that often break rooms for employees are filled with candy, donuts, people have dropped off pizza. It's well intentioned, but ultimately it ends up setting this reward element that keeps people eating foods that are not typically healthy for them. It is often sort of coupled with an environment where it's hard to take a real break during the day. It's hard to find the time to eat a healthy meal, step outside, drink water, all of those things that would be healthy for us. And instead, it's like, no, go grab a cup of coffee and donuts in the break room. When we work in an environment like that, we're going to need to decide what we are and are not going to do because we're not usually going to be able to control that environment. So we may be able to control what comes into our house and what stays out of our house, but we don't have control over whether somebody drops off donuts in the break room. And again, if this is something that is common, you're going to need to learn, what do I choose to do when someone has dropped off donuts? I can't stop myself from seeing them, but how will I talk to myself and decide what is and isn't okay? In cultures where there is like a lunch provided, every day, which happens in a lot of our tech settings, again, the choices may or may not be healthy, and it may seem unfair that everybody else is getting this meal. But if I want to meet my health goals, I may need to decide, you know what, I'm going to choose not to eat that food. It sure would be nice if there were healthy options. I can ask for healthy options, but I need to be in charge of deciding what I will and won't eat in order to meet my health goals. When we treat our health goals as being more important than the perk of having food provided, for example, we're going to make progress. When we choose to take breaks so that we can get a little bit of movement in, where we can get a little bit of outside time, where we sort of break free from this culture of hustle and overwork and don't take breaks and work the hardest, that's how we're going to be able to meet our goals.